Welcome to the AUANews Inside Tract podcast. Today's Inside Tract podcast is part of the AUA Census Trends series, which is brought to you by the AUA Data Committee. This series explores key insights from the AUA Census, highlighting how data informs workforce trends and broader patterns that shape the future of urology.
Welcome to the AUANews Inside Tract. I'm Dr. Catherine Nam, Assistant Professor in the Department of Urology at the University of Michigan, and also a member of the AUA Workforce Task Force.
And I'm Dr. Hannah Glick. I'm a third-year urology resident at the University of Michigan.
And this week, we're talking about the AUA Census Trends on burnout, which has been a topic of interest to the AUA, and the AUA Census has been including questions on burnout starting in 2016. And the census has found that the burnout prevalence among practicing urologists is nearly 40%. And given that burnout has been associated with lower retention and decreased clinical hours, this is especially concerning in the context of the ongoing urologic workforce shortage, which is projected to only get worse in the coming decades.
While there's been an increasing interest in evaluating prevalence of burnout among urologists, there has been limited research in coping mechanisms utilized by urologists in the face of burnout and stress. At the same time, we know that there's stigma around seeking help for mental health of physicians, and only 21 out of 50 states include questions pertaining to mental health as part of physician licensure. At the same time, we know there's stigma around seeking help for mental health as physicians, and 21 out of 50 states include questions pertaining to mental health as part of physician licensing and credentialing applications, which we hypothesize may deter physicians from seeking professional mental health services.
So the AUA Workforce Task Force sought to evaluate coping mechanisms utilized by urologists, urologists' willingness to seek professional help, and barriers to seeking professional help for burnout and stress. And to answer these questions, we utilized the AUA Census data from 2023. Dr. Glick, can you highlight some of the key findings of our work?
Absolutely. The overall burnout rate from the AUA census in 2023 showed that 45.4% of urologists were currently experiencing burnout or stress. With this in mind, our work really highlighted three main findings. First, we found that 1/3 of urologists who responded to the census utilized unhealthy coping mechanisms in the face of burnout or stress. The top three were alcohol use, isolating from others, or eating junk food. Second, we found that only 17% of those urologists sought professional help when experiencing symptoms of burnout. The top three reasons they didn't seek professional help was they did not believe they needed professional help, they were too busy to seek professional help, and they did not want to seek professional help. Third, a third of respondents identified external factors as barriers for seeking professional help, with 43% reporting that they would be more willing to seek professional help if utilizing these services for burnout, stress, or other mental health reasons did not need to be reported or included in the records for state licensure boards. Dr. Nam, can you elaborate on what we mean by external factors?
Sure. When we say external factors, we include factors that could potentially be addressed with policy changes, such as access to professional help for burnout, or autonomy over your schedule, or changes in the licensure laws. On the other hand, internal factors refer to the stigma surrounding seeking professional help or mental health.
While stigma around experiencing burnout has decreased, there's still a lot of stigma around seeking help for mental health, such as depression. Dr. Nam, could you elaborate on the differences between burnout and depression and why understanding how they interact is vitally important to this work?
Absolutely. And you bring up a great point, Dr. Glick. When we discuss getting professional help in the setting of experiencing burnout for urologists, they often think that it's unnecessary. But there is interplay between depression and burnout that is very important to explore. Burnout was first described in the 1970s with three key components of emotional exhaustion, depersonalization, and decreased sense of personal accomplishment, whereas depression is a clinical diagnosis, which we're familiar with. Currently, burnout has been seen as a systems issue, whereas mental health has been seen as an individual issue, which continues to be stigmatized. So despite being two distinct entities, prior work has often shown that burnout and depression are comorbid, and seeking professional help can decrease burnout symptoms. So once again, I want to highlight that almost half of the states in the US require physicians to report utilization of professional help for these conditions on licensure. So the question is, what are some actionable steps our listeners, whether they're physicians, administrators, or policymakers, can take today to shift this culture?
I think there are steps on each level which are important. Starting at the physician level, we need to continue to advocate for our own well-being and create a safe environment where everyone feels safe to seek the help they need. It really starts with normalization. No one should be forced to share this information, but the more we discuss the struggles we have instead of burying them or hiding them, we'll continue to help normalize the experience and destigmatize accessing the professional help that is needed. At the administrative level, continuing to take feedback to adjust to the needs of the staff. For example, physicians experience an incredibly large amount of clerical work, which contributes to burnout. Implementing efficiency tools or access to something like an AI scribe can help expedite this. Also, supporting the notion of work hour flexibility to be able to better achieve work-life balance. We've all been to the mandatory wellness session in the evening after a long work day, and that takes us away from achieving the work-life balance. So understanding the needs of the population you work with is very important. But I think maybe the most important is at the larger scale. Our work provides data to support that nearly half of responding urologists would be more likely to seek professional help for mental health needs if they were not invasive questions or required reporting of records on state licensure boards. This is an obvious area to target policy change. One example is the Lorna Breen Healthcare Provider Protection Act. It was enacted in 2022 and was really a first of its kind law that focused on protecting and improving the overall mental health of the healthcare workforce. It supported this work really at all levels, grant funding, helped enact programs that combated burnout or mental health issues. It supported national campaigns to continue to destigmatize burnout or mental health concerns among healthcare workers. And it promoted research for barriers that healthcare workers face in seeking out professional help for mental health. Unfortunately, much of the grant funding expired at the end of 2024 and has not yet been reauthorized by Congress. There is a reauthorization bill that's been introduced to continue funding through 2029. And all healthcare workers, including urologists, should continue to advocate for the reauthorization of this by contacting their elected officials or by joining advocacy groups. Dr. Nam, as we close out the podcast, do you have any closing words for our listeners?
As Dr. Glick highlighted, I think there's a lot of room with advocacy for the listeners to make actionable change at departmental, institutional, state, and even national levels. And on a day-to-day basis, we need to continue to destigmatize burnout and mental health for us to be able to look out for each other and also for us to be able to take better care of our patients. And for any listeners who are struggling with burnout or stress, we just want you to know that you are not alone and that there are many ways for us to be able to support one another. And we would like to thank you for joining us today on AUA Census Trends.
This has been AUA Census Trends, an AUANews Inside Tract podcast brought to you by the AUA Data Committee. For more information about the AUA Census, visit auanet.org/takecensus.